Hi, I'm Maggie Laukant. I'm a Maryville University student in the nurse practitioner program, and I'm going to be performing the eyes, ears, nose, and throat assessment on Dave. I'm going to start out by checking his vision. I'll start with the Snellen chart, which checks his distance vision, and then I will move on to the Rosenbaum chart to check his near vision. Next, Dave, I'm going to have you cover your right eye. I'm going to cover my left, and we are going to check for Dave's periphery. I just want you to tell me when my fingers are in sight.
Yes. Yes.
Good. I would check that on both sides just to make sure his peripheral vision is all intact. The next thing I'm going to have you do is we're going to check your 6 cardinal fields of vision, and that's going to be checking your 6 ocular muscles as well as your 3 cranial nerves, the ocular nerve, the trochlear nerve, and the abducens nerves. So all I want you to do is just watch my finger as I move it from floor to ceiling, and all of his ocular muscles are intact. Next, Dave, just keep your head still, and I'd like you to watch my finger as I check for nystagmus. I'm going to be tracing the letter H, and I'm just watching to make sure that you don't have any nystagmus, which is involuntary movements within your eye, and you were fine, thank you. If we needed to check for further nystagmus, we could do the cover-uncover test. The next thing that I'm going to do is check your eyeballs. The external eye assessment is done by just checking to make sure there's no drainage, there's no styes, there's no flakiness, no crustiness, anything that looks out of the normal, and I'm going to tell you what the normal is. I'm checking his eyebrows, just noting that he has thick, coarse eyebrows that extend to the temporal campus. His eyelashes extend over his entire eyelid. They curve away from the globe, and we're looking to make sure that his eyelids open and close completely, and they do. We're also making sure that his eyelids don't have any inversion or eversion. We're looking at, I'm going to pull your lower lid down, and I'm just checking the conjunctiva as well as the sclera to make sure that it's free of hemorrhage, drainage, any foreign objects, and that your sclera is white. Although Dave's sclera is a little bit red tonight because he has some allergies and was out mowing the lawn for me tonight, so I appreciate that. Next, I am going to just check and make sure that we do use my ophthalmoscope, and we're going to check for perla, which is making sure your pupils are equal, round, and reactive to light, and I'm going to do that just by bringing across your eyeball and looking at how your pupils react to that. So thank you. Then I'm going to use my ophthalmoscope. When I look at Dave's right eye, I'm going to use my ophthalmoscope in my right hand and use my right eye. I'm going to start about 30 centimeters away from him, and I'm going to start by just checking to see if I see the red reflex. And I do, so that's good. The next thing I do is I'm going to move in really close, Dave, and I'm going to look for the retina or the fundus, which is kind of a pinkish yellow color. I'm going to look for the vessels that extend beyond that. I'm going to look for the optic disc, which is kind of a creamy color, and the macula, which will be up in the temporal area, just off to the side of the optic disc. So I'm going to look in your eye now. I'm going to move very close. Good. Thank you. All right. Let me set that down. I'm going to do the hearing test next, and we've kind of been doing that all along, haven't we? He's been responding quite well to my commands and my requests, so I know that his hearing is intact. Before I do any further actual hearing, making you listen, I'm just going to note that your ears are, you're showing them off, your ears have no nodules, no bumps, nothing like that that we need to worry about. There's no drainage from them. I'm going to palpate his auditory and the mastoid process, just to make sure there's no nodes or tenderness back there either. I'm going to look inside your ear, As I look inside the auditory canal, I'm assessing for amount of cerumen, which there's minimal. I am looking at the tympanic membrane at the back. I can see the bones of the ear behind the tympanic membrane, and the membrane itself is kind of a gray, pearly gray color with the cone of light off to about a 5 o'clock position. His ears look good. So since they look good, and you've been hearing me all along, we're going to actually test your hearing with a couple of tests using the tuning fork. Before I use the tuning fork, I would like you to cover your left ear. We're going to do what we call the whisper test. And I'm just going to say a few words, numbers, or letters, and I just want you to repeat those. I'm going to say them as I move away from you.
917 dog?
That's what I said, thank you. So that's all intact as well. Now with the tuning fork, I have two tests that I'm going to do. The first one is the Weber test, and I'm going to strike the tuning fork, and I'm going to set it up on top of your head, and I just am checking to make sure that you're hearing in both ears about the same. Ready? Tell me if you can hear it in one ear louder than the other.
Cheers.
Good. The next one that I'm going to do is called the Rhine test. And the Rhine test is where I also strike the tuning fork, but I place it on the bony process behind his ear, and then when he can no longer hear that sound, I pull it out here and I let him finish hearing the sound through the air. And what we're checking to see is if the air conduction or the bone conduction is better for his hearing. Just tell me when you can no longer hear it. Sorry.
Okay. That's about it.
All right. And the air conduction was about twice as long as the bone conduction, and that is exactly what we're looking for. The last thing that we're going to assess, Dave, is your mouth. And I'm just going to note from the outside that Dave's lips are symmetrical. There's no edema. There's no lesions, anything like that. I'm going to grab my tongue blade, and I'm going to look inside your mouth. With that, all I want you to do is just open up, and I'm just going to move your tongue from side to side, looking for any lesions. I'm noting that the mucosa in the tongue are pink and moist. His teeth are all intact. I just want you to stick out your tongue and move it side to side. Good, I'm looking at cranial nerve number 12. I want to look deep in the back of your throat into what we call the oral pharynx, and I want you to say ah. Good. Your uvula is midline. Everything looks good back there. There's no lesions, there's no swelling, there's no beefy red tissues. I'm going to also poke in one more time, and I'm going to do what we call elicit the gag reflex. And that worked. But I also noticed that you don't have any tonsils back there. But you did tell me that they removed them when you were age 5.
Yes.
And so you knew that, although that's an abnormal, you knew that they actually took them out of you.
I did.
So that's good. That's the end of my assessment. Thank you, Dave. And thank you for watching my assessment.